Okay, well, I think we can get started and I'll just add people as they come into the room. I really want to, I thank everybody for being here tonight. I know we're all busy. And Dr. Say, thank you so much for being here and guiding us as moms into this new virus. Trying to figure out this new, oh gosh, what is it? Like there's three viruses going around right now, or supposed to. So
Oh,
I'm on
thank
edge.
you, sure.
On
No,
edge.
happy to be here.
Yes. So thank you. And I look forward to your presentation, and we'll open it up for some questions at the end if the questions are not answered during your presentation. And so thank you.
Sure. All right. Um, so let me see. I think I can get this going. All right. That should look right for you guys.
Yes.
All right. Good evening, everyone. Thank you very much for having me. I'm Graham Say. I serve as the Chief Medical Officer at Miller Children's and Women's Hospital in Long Beach. I am, by training and still clinically active, a pediatric intensivist. I've been at Miller Children's this is my 26th year. I've been a pediatrician for slightly longer than that. I've dealt with RSV my entire life. So I also served as the physician in charge for our COVID response for the entire campus, which included our adult hospital. So I'm fairly versed in dealing with pandemics now and the surges. So I know there's a tremendous amount of angst and concern, and I hope I can answer your questions and some of your fears at ease. I've got nothing to disclose. I don't have any financial arrangements which could impact the content of this presentation. So I figured for this group, I'd just go over some of the current state of infections, how we sit locally and nationally, talk about RSV, some of the epidemiology, certainly some of the signs and symptoms, especially in our pediatric population. Talk a little bit about testing. That's a common question is, how can I get tested? Should I get tested? And then what can I do about it? Should I have symptoms or I be diagnosed with RSV? And certainly we'll have time at the end to do some questions and answers. So please, it's a small group. I invite you to just put your hand up, speak up, chat. We'll try and cover it all ways. So the news agencies have really taken off with this. The phrase that is I've seen most recently is triple demic, where instead of one epidemic, it's actually three, and they're talking about flu, RSV, and COVID. And actually, as I was driving home this afternoon, I heard the radio person call it a quaddemic. I think they were adding another virus. There's lots of viruses running around at this time of the year. It is a little bit earlier, but what is unique, and I think what has people concerned this year, is that we are seeing some of these viruses in numbers that we don't typically see until much later in the season. Generally, either late December or even into January and February. So we're seeing them earlier, and we're seeing them in pretty significant numbers. I'll show you some graphs where the last couple of years for pediatrics, it has been really unusual in that our numbers in the viral season have been very low, and I'll explain that. Most of you probably know that the Orange County Health Agency actually declared a local public health emergency to deal with the surge in viruses, mainly affecting pediatrics, and the stresses and the issues it was having on the healthcare facilities in Orange County. So it definitely is a problem. So looking at some of the epidemiology and well, more of the rates and what's happening now, this is a database maintained by the Centers for Disease Control, and this specifically refers to RSV. And so all the numbers, and I'm hoping you can see my cursor there. Where we are right now is this green line with the circle, so the hunter green basically. This is the 2022 season where we are right now. And you can see on the bottom, it starts in October, November, December, and it's just a rolling year. This is hospitalization rate per 100,000. This is the most recent data. I think this little dip here most likely represents just data lag, data from that time period hasn't made its way to the system. But all the other lines here are different years, and you can see the legend at the bottom. So the first year of the pandemic, which was 2020 and 21, is actually this blue line with the squares. And this is very unusual. We basically saw very little RSV the entire year. And then later in 2021, you can see here in May, June, July, we have a little bit of an upslope. These purple lines and the peach line, I guess it is, represent kind of, these are pre-pandemic years and are more the typical seasons that we see. You can see that we peak in starting in December, kind of peak in January, February, and then slowly taper out by usually March or April. It runs its course. And then the last line is just 21, 22. So last year's season, you can see that we started fairly early, but not huge numbers. Definitely saw more than we saw the previous year. And then it disappeared basically for the most part in January. But the unusual thing is we've been having intermittent cases of RSV throughout the summer months. And when I say we, I mean the country as a whole. Certainly what we see here is not unique only to Southern California. The whole country's seen that. But then it really took off in October and now in November. And we're very much experiencing a surge in RSV amongst other viruses. So this one is RSV. Um, Flu looks very similar. So for those that aren't familiar, this is the map of the country that the CDC maintains that looks at flu activity. And ILI here stands for influenza-like illness. So symptoms consistent with influenza. And they track it every week. Purple means a very high level of activity. That's the highest color, in green, or actually green, dark green is minimal. And classically, it starts generally on the East Coast and moves its way west, and California and the western states are kind of the latter part of the country to get the flu surge. You can see that the southeast and the eastern part are seeing high to very high activity. California just in the last week turned to this red color. We're seeing activity, fairly high activity, and that's across all ages, including pediatrics. It's not quite as prevalent at this point in time as RSV, but this flu season is already off to a very good start. In the bottom right of this slide, you can see the big yellow arrow. That is the flu. This is percent of visits for ILI, influenza-like illness. And you can see we've started earlier, and it's going up very quickly. These other years, or other colors, I should say, of lines represent, again, different years for the past 5 years. So one, we're off to an earlier start than the previous 5 years. And two is we're probably going to be having a much more significant severe flu season. Again, back in 2020, which is this pink line here, this is the first year of the pandemic, the first winter, you can see we had very little activity. The reason for the low RSV, the low influenza, was the things that we were doing for COVID. If you can remember back to 2020, we weren't visiting people. Some of us were in our houses, not going out. We were masking, or certainly trying to find masking. We were pretty obsessive with hand washing, social distancing, not visiting and seeing loved ones. And all those things certainly had a positive impact on the transmission, or a negative impact on the transmission, which is a good thing, of all these respiratory viral illnesses, just because we are not visiting and interacting with other people. The other arm, or the try of this triple demic, is COVID. So the fortunate thing is COVID, for the most part in the US at this point in time, is at low levels, both in cases and in hospitalizations, and certainly deaths. This graph here I know looks very busy, but what it represents, pardon me, is the various variants that are out there. And this is as well here on the bottom by week. And what this is showing, and this is the United States from August, the beginning of August, till the most recent week that they have data on, mid-November, is that the variants are, they come and go, basically, or they generally come and then they disappear, taken over by other variants. So BA5, which has been in the news for many months, is now not the major variant. It's being taken over by BQ.1, BQ1.1.1, BF.7. The numbers or the variants themselves are not important. They're still highly infectious. The good thing is they don't appear to cause more severe disease than the previous variants of COVID or the original strain of COVID. The trouble is, or the concern is that BQ.1 and BQ.1.1 has already caused increases or surges in Europe, which has historically preceded the US in their surges. For various reasons, they tend to have increases before we do. And so the forecasts are that we anticipate an increase in our COVID cases. Fortunately, pediatrics don't tend to be as severely involved. We do tend to see some increase in admissions, but oops, sorry, I may have to these people. There you go. We do anticipate to see some increase in admissions. So again, with everything kind of unfortunately peaking at the same time, some people are using the term perfect storm with RSV going up, influenza going up, and COVID probably going to go up. This is putting some significant strains, especially this time on the pediatric side, right now mainly driven by RSV. The graph on the right is Health and Human Services Region 9. That's just the region that California falls into. Pretty much the same variants, just slightly different proportions. This is from the state of California, again, representing data on cases, deaths, and test positivity. And so for the most part, from August, September, they have slightly different date ranges. Cases and deaths have been going down, as well as the positivity rate of tests. You can see that cases and the positivity, test positivity rate seems maybe to have leveled out, maybe creeping up a little bit. Again, something we keep a close eye on. It's a little different today than it was a year ago or a couple of years ago, because everyone has home tests. They do a home test. They don't report it to public health. They recuperate and recover at home. And so the data is a little bit skewed, and it's not quite as robust and as accurate as in the past. But it's something we definitely keep an eye on. Regardless, we probably will see an increase in cases. This is just reminding or representative of the various ages and the different vaccines that are available. It gets fairly complicated in terms of the dosing and the intervals. But the bottom line is everyone from 6 months of age up is certainly eligible for vaccinations. And then boosters are a higher age group, 5 and above. And certainly through vaccinations of COVID and also having infection, the immunity of the population has certainly improved. But if you have not been vaccinated and have not got an infection, the chances of severe disease and hospitalization is still very real and very significant. So the hot, virus of the times is RSV. And so RSV stands for respiratory syncytial virus, just a big name. It's a very, very common virus. So it was first identified in 1956. It's one of the leading causes of childhood illness, highly contagious, and seasonal, typically late fall to spring, as I've talked about, tends to peak in the winter, January, February, and then slowly taper off. In the vast majority of cases, it causes bad cold, very similar to other respiratory viruses. In the very young and the very old, it can go down into the deeper airways, or what we call the lower airways, and cause a condition known as bronchiolitis or viral pneumonia. And that younger age group is really the ones that tend to be in the pediatric world the most affected. It's so prevalent worldwide and during the winter months that most kids have had at least one RSV infection by the age of 2. And everyone on this call or on the Zoom have almost undoubtedly had RSV. If you have not had RSV, you literally have been living in a bubble somewhere, because if you go out and about in the winter and get a cold, at some point in time, it was probably RSV. So some of the symptoms are like a cold, runny nose, may have a decrease in appetite, cough, sneezing, sometimes fever. Sometimes it can be a little bit on the high side. One symptom or sign that's very unique to RSV over some of the other viruses is if it goes into the deeper airways, what we call that bronchiolitis, is they may get that wheezing, which is a noise when the baby's exhaling, that high pitched noise. And as I said, in adults, most have very mild to no symptoms. A small percentage, 1 to 2% of those under 6 months of age may require hospitalization, though anyone could be severely affected. Again, that's much less common and require hospitalization. Most of the kids that currently, and which is typical for RSV, that are in our intensive care unit right now requiring a lot of support are all, most of them are under 6, and those that even require higher support are generally within their first 2 to 3 months of age. Just some of the symptoms that we already talked about. Again, I don't want people to be really, really scared of this virus. I think there's things I'll talk about that can help prevent it. But in the majority of individuals, especially older kids, and even in toddlers 1 to 2, and even younger kids, the vast majority are going to have cold upper respiratory tract like symptoms that you can see there. RSV tends to really cause a lot of secretions and a lot of, sorry for the lack of the medical term, snot. And so in the really young kids just are smaller, so they have smaller airways. They get more easily plugged up. They have smaller airways, and so again, if they get any type of swelling or secretion in there, they tend to have more symptoms. And the very young kids are what we call obligate nasal breathers. Their brains haven't developed to the point where they realize or can realize that if their nose is plugged, they can open their mouth and breathe through there. When you're 1, 2, 3 months of age, you actually they have to breathe through their nose, and so if it's all plugged up with secretions and snot, they actually look horrible. We've all had bad head colds where our nose is all plugged up and we're breathing through our mouth. Can you imagine if you didn't breathe through your mouth? You would be miserable. You'd be sitting there snorting away, couldn't get enough air in, and that's exactly what happens in the vast majority of kids. A lot of it is upper airway. So I'll talk about treatments in a little bit. When it goes down into the lower respiratory tract, what we call the bronchiolitis, or some people will call it viral pneumonia, this is when kids can get into real trouble as well. When they're having fast breathing, what we call tachypnea, flaring of the nostrils, they can be lethargic, head bobbing, wheezing. And so that is a much more serious issue, especially once they've out of the obligate nasal breather phase. So, wow, there we go. I'm going to show you a video, and it's some of the signs that really to look out for on real young kids that probably should seek higher level of care. Certainly calling their pediatrician, or if you're really concerned, calling 911 or getting them to the emergency department. So again, fast or short bursts. You see this child breathing really fast. If they're making funny grunting, if you see the ribs getting pulled in or the skin getting pulled in between the ribs or pulled in right under the what we call the costal margin with the rib cage ends, and certainly if you're seeing any blueness of the mouth or the fingers, the patient's very lethargic, those are things that are very concerning. And those are not things that you should just say, well, let's see how he is, tomorrow morning or a couple of hours from now. I strongly suggest you seek higher level of care. All right, there we go. So who is at higher risk? The list here is fairly extensive, but these individuals here probably can certainly end up sicker with RSV and other viruses. Premature infants, they're young, their immune systems aren't fully developed, they've got small airways, they can have chronic lung disease. Certainly RSV affects those younger than 6 months of age. Uh, Immunosuppressed individuals definitely can get sicker. Those with neuromuscular disorders, so if they have weakness, difficulty swallowing or clearing secretions because RSV causes so many secretions, that can cause significant problems in those individuals. If the child has asthma, any type of virus can cause an exacerbation of their asthma. Those with heart disease as well can have issues. Older adults, the older you are, if you also have comorbid conditions such as emphysema or lung disease of various types, getting RSV and other viruses definitely can make them fairly sick. And again, those with chronic lung disease, heart disease, or weakened immune system. And I see someone chatting. Is that true even with COVID kids, or is that why numbers are so high, lack of regular exposure? So I think that question was, what is there is the numbers that we're seeing right now because people haven't been exposed or the young kids haven't been exposed to RSV. So the reasons behind why we're seeing such high levels are multifactorial. One of the biggest ones is people are not following the practices that we followed during COVID as well as we did a couple of years ago. And I'm talking about things as simple as hand washing, socially distancing, mask wearing, not going around sick people, and people are traveling and interacting and going to get-togethers, et cetera, et cetera. And so RSV and other viruses are generally caught through RSV specifically through what we call contact and droplet. So if you're talking to someone and they cough on you and the droplets can come in through your nose, through your mouth, through your eyes, you're going to get most likely infected if you haven't had it that season or if you had it previously earlier in the season. The virus can live for several hours on hard surfaces. So again, if you grab a doorknob after someone's, wiped their nose and grab that doorknob, you could catch it from there as well. So there's those practices that we're getting a little bit lax on as a society. There is a theory out there that there really hasn't been proven data or evidence-based medicine, as we call it, where because the levels of RSV were so low in that first year of the pandemic and then still relatively low in the second year, along with flu and the other viruses, because again, we were practicing all those practices that help prevent us from catching COVID, also helped us prevent catching other diseases and other viruses, that children haven't been exposed to these viruses. Mothers haven't been exposed and passed on the antibodies that are produced when they get infected to their babies through the placenta and through breast milk, that there's the term immunodeficiency, or not immunodeficiency, but immunodeficit, where they just have absolutely no antibodies to previous flu infections from the previous year, which could provide some some protection against the current year's viruses and flu. And so that's a possibility as well. Though most likely, the biggest contributor is just the practices that we do. Again, hand washing, social distancing, masking, cleaning, those really make a huge difference. I hope that answered the question. Please, if it didn't, either rephrase it in the chat or certainly to um, happy to happy to answer it directly. Oh, there we go. I think that answered the question. All right. Um, so talked a little bit already about when to seek help. If there's symptoms of bronchiolitis, that fast breathing, the skin's getting pulled between the ribs, the child's lethargic, not eating, if they're getting dehydrated. In the very young, RSV especially can cause apnea, which is pauses in breathing. So if you're watching your child and they're really having long pauses between breaths, seek medical help. Obviously, if you're gray or blue and just don't look well, that's something that needs to be evaluated. And if they're not getting better after a period of time, if they are having fevers past 5 to 7 days, they're just not, they're breathing, even though it hasn't been bad enough to go to the hospital, or see their pediatrician. If it's just continuing on, it could be that they've got another infection on top of the virus. And it's not uncommon to start with a virus. Your body and your defense systems get broken down by the virus, and then you get an infection on top of it, typically or commonly by a bacteria, which would require some antibiotics. That's quite possible. So that's why we'd like you to seek medical attention so that can probably be evaluated and potentially treated. So testing, we've become very attuned with COVID and encouraged to test ourselves. Again, in the vast majority of cases, this is a bad cold, even in pediatrics. And testing is in most cases is not particularly necessary. And my question is, what are you going to do with the results? If you're negative, are you going to do anything different? Or if you're positive, are you going to do anything different? If especially, during the pandemic, and I think especially this season, if you're sick, you shouldn't be going to work. You shouldn't be sending your child to daycare if they're obviously sick, or to play with other kids. And that's part of the problem is people have just gotten more lax in the practices that they're doing in terms of that. And I get it. It's been a rough 2.5 years, and people want to have a normal, regular Thanksgiving. And unfortunately, that's causing person-to-person transmission. So in terms of testing, certainly at urgent cares, hospitals, some doctors' offices, we can test for RSV. All the kids that are admitted to Miller Children's get an extensive respiratory viral panel, which includes all three of these viruses as well as several others, so that we know what they have, and sometimes we have to pair patients up in rooms that we can pair patients appropriately. There is one FDA-approved home test that I know of. It's by LabCorp. It does COVID, flu, and RSV, but it's a nasal, I think it's a nasal swab, but you have to send it in. It's not the rapid antigen that many of us know that we can test ourselves in COVID, get a result in 10 or 15 minutes. This one has to go back to the lab, and then you get the results in 1 to 2 days. So if you feel that you really want to know what if it's RSV or not, you can certainly get a home test, or go to many of the testing sites. But I again would ask, what are you going to do with the results? If your child's doing reasonably well, yes, they have respiratory symptoms and they're producing a lot of mucus and snot, you treat it like a typical cold. You're not going to change your behaviors just based on the fact that they're RSV positive. And again, the difference here is RSV has been around for decades. This is not COVID, where the effects of COVID were and still are fairly significant and causing severe disease and deaths. There was the absolute reasons to test for COVID. And the big thing is, and I'm going to talk about it, is treatments. COVID, there's things we can do for COVID. There's things we can do for influenza. There's very, unfortunately, little we can do for RSV. Pardon me. So, there are no specific treatments for RSV. You may have heard or will hear there's a medication called Synagis. The generic name is palivizumab, which is a prophylactic medication. It's actually given every month for up to 5 months of the RSV season. It is for a very specific population, and I have a slide just coming up. And that's because there's limited data on efficacy, and it's really reserved for the high risk population. So conversely, there are treatments for influenza if you have influenza, and so there is some importance in diagnosing that, as well as COVID. And for influenza and COVID, there are vaccinations. Both of them, well, influenza is yearly vaccination, and that is because the influenza virus changes every year. And certainly on the COVID side, boosters are recommended for the vast majority of the population. We do know that, unfortunately, the COVID vaccines don't protect you against any illness. They certainly protect you against severe disease and hospitalizations. And boosters definitely raise your antibody levels. As we talked about, the best defense against RSV and influenza and COVID and all the other viruses out there is a good offense, which we've already talked about, is hand washing. Probably one of the simplest and most effective ways to prevent catching things. Trying to avoid your kids touching their face, yourselves from touching your face. Data and observation shows that all of us probably touch our face 1,000 times a day. We don't think about it, but we do it without even thinking about it. Just avoiding that, because the entry points are, again, your eyes, your nose, and your mouth. And so when you're rubbing your eyes and your hands have viruses on them, they can enter through the eyes. Certainly, if you rub your nose, etc. Masking still has probably its place, especially this winter. And I've restarted masking when I'm going to the grocery store or Home Depot or in really busy places. I am taking a flight next week, and I fully plan on wearing a mask while I'm on the plane. Again, I can protect myself. I can't control what people do around me, but masks definitely provide some protection. Again, if you're sick, not going out in public and avoiding ill people. I had an individual ask, "Hey, we got 30 people coming over for Thanksgiving with a 2-month-old newborn. Is it okay for the newborn to be there?" A lot of these viruses, you can be contagious before you're symptomatic. So just because, hey, I feel great, I'm not sick, you can still pass that on. And so, again, the social distancing, I actually told them, I don't think, the baby needs to necessarily stay away, but at the same time, I wouldn't want those 30 individuals kissing the newborn baby and touching them and holding them. But everyone has different, risk tolerance and risk profiles, and it really has to be an individual choice. And so these are things that can definitely make a difference. In terms of RSV and viruses in general, the 4 bullet points at the end are things that we can do. So we talked about how there's a lot of secretion. So nasal saline and gentle suctioning with bulb suction, especially in those young kids, can make a huge difference. I've seen kids where I've had ER docs believe that the child needs to have a breathing tube put down, and we go and suction really well, and then they look absolutely fine. Very, very common in those 2-3 months and under children. Make sure you get humidification. My skin certainly has started to dry out in winter months. But what happens is those secretions get really thick and really sticky. So making sure that there's some humidification in the child's room, ensuring that they get lots of fluids. If you get dehydrated, the exact same thing happens. Your secretions get thicker. Making sure they're drinking, that they're maintaining their hydration can help. And it's absolutely fine to give acetaminophen or ibuprofen in those greater than 6 months of old to just make them feel better, bring down low-grade fevers, and help with just the general unwellness. And unfortunately, those are the treatments we can give. RSV is a virus. Antibiotics don't work. Steroids don't work. Lots of people like to give them because the RSV can sound very much like an asthmatic, where steroids can work. It has never been proven to be a benefit. Breathing treatments to treat the wheezing, just like we do in asthma, as well, haven't been shown to work. Sometimes we'll try them just to see if they'll make a difference. If it does make a difference, we'll continue. But there really has, unfortunately, been no treatments that have proven benefit. It is symptomatic treatment. These are the Synagis guidelines. They change every year. I'm not going to go over every one, but you can see how the criteria, and this is from American Academy of Pediatrics, our very large pediatric medical group. Um, these are the guidelines that they have for this season. So if you're premature, and it's very specific, less than 28 weeks and 6 days of gestational age, and you're less than or equal to 12 months of age at the start of the RSV, if you have chronic lung disease, if you have hemodynamically significant congenital heart disease, a neuromuscular disorder, immunocompromised, cystic fibrosis, and again, even if you have those, generally less than 12 to 24 months of age, with some other abnormalities. And this again is prophylaxis. It helps prevent severe disease. You could still definitely get RSV even if you're receiving Synagis, and it requires monthly shots. And so at Miller Children's, we have a clinic where they come in every month to get their shot. And in this specific population, it definitely, I think, helps, but it's not a medication for the general population. And I'm not encouraging healthy children to try and go and get on a Synagis regimen for this winter. There's no need to do so, and you'd find it very difficult to actually these are charts that I just borrowed off the web, but they kind of go over the differences between the common cold, influenza, COVID, and RSV. And I again don't want to go virus by virus, but yeah, I draw attention to the bottom here of RSV. It is very contagious. Again, in most individuals, it's going to cause a cold or a slightly worse side cold. Incubation period, someone asked, is about 4 to 6 days, and symptoms can last for 7 to 10 days. Generally, your infectivity kind of disappears or goes down after 10 to 14 days. But some individuals, especially those immunosuppressed, can remain contagious with RSV for up to 4 weeks. It can, as we talked about, go into the lungs, what we call bronchiolitis, and those are the individuals that were really seen in the hospital, as well as the very young that require just frequent suctioning. On the right-hand side are just some of the symptoms. Again, RSV, a lot of secretion, stuffy nose, cough can be there. It can cause apnea. Flu makes individuals just feel lousy. Myalgias, fever, really not feeling great. They can have a little bit of a cough, but secretions aren't so much. And then COVID-19 overlaps kind of the two of them. They can have the general aches and pains, certainly some fever, just being exhausted. With the new variants, we don't really see a lot of the loss of taste or smell, but COVID can rear its head in different ways. But those are kind of the big differences between the COVID, flu, and RSV. So some of the questions that were submitted prior to tonight were, does age make a difference in the severity of symptoms? Absolutely, we talked about it. So the very young, under 2 to 3 months of age, and then the toddlers under 1, 2, 3 of age, those are the ones that are classically admitted. And again, very young, under a few months of age, a lot of it is upper airway requiring secretions. Some of them have pretty severe lung or bronchiolitis. We do have some that are requiring breathing machines to help them with a tube down their throat into their windpipe. But most of them are either discharged if they happen to come to the emergency department from the ED, or they're on our general pediatrics. The very old or the elderly, especially those with underlying medical conditions, can be severely affected by RSV. But again, it's mainly a disease of children. What if I'm traveling during the holidays, and how can I protect myself on a plane? It's the exact same thing we did during COVID. And I mentioned I'm traveling. So I strongly recommend hand washing as often as you can. If you can snag a seat with no middle person, if you're flying alone, um, always better. Wiping down with one of the wipes, Clorox or Purell or whatever the wipes are. Absolutely, we know that planes aren't fully cleaned in between, and again, viruses can live for several hours on a hard surface. Planes turn over, within an hour or so. I wipe everything down, and then if I'm eating, and wearing a mask as well, certainly help protect yourself. Um, what my colleagues tell me, and sorry, I was just thinking when I was last on a plane. I think I was on a plane in December. Um, fewer and fewer people are wearing masks on a plane, and so that's what I will do. That's what I recommend for people traveling this holiday season. How long for the symptoms to set in, and what is the exposure window? Again, it's a few days to a week, kind of, to for symptoms if you're exposed to potentially manifest themselves. However, people can be contagious before they're symptomatic a day or two before, and then up to 7 to 10 days. It varies virus to virus, but the problem is not everyone is symptomatic before they're contagious. So I saw some just pop up in the chat. How long after using a Clorox wipe is it safe for children to touch the wipe surface? So um, again, there's many different disinfecting wipes out there in the hospital. Um, if you read the label, you would never use them without gloves, but Clorox isn't quite that way. My recommendation is most of these actually have to have a wet time, meaning that the surface actually remains wet. If it's not just a wipe and you're done, so you actually want that surface to get wet. And what I recommend is leave it sitting there until it dries, which generally takes a minute or two. And once it's dry, it's safe for the kids to touch. But you actually want that liquid from the wipe to sit there wet and dry. That's how that doesn't 100% ensure, but that's how the viruses get killed. It's not just wiping it; it's sitting there and letting it dry, and the wet kind, basically. Another question. Let's see. Oh, yep, just a response to that. When should I see a doctor? So uh, we talked about some of the symptoms. You saw that video. Certainly lethargy, blueness, um, working really hard to breathe, inability to eat. If they can't keep fluids and food down, especially in the very young, they're probably going to need to be seen, potentially IV, potentially get admitted. Um, Along those same lines, most can be handled at home. And, they're just going to have a cold. But if you're concerned and they're doing okay, certainly I don't recommend coming to the emergency department. Emergency departments are really busy right now. There's lots of individuals and kids that have other infections and RSV. And if you don't have RSV, you're going to probably get it in the waiting room potentially. Certainly talking with your pediatrician, the nurse line, there's telemedicine and video conferencing, and actually keeping them out of the doctor's office as much as possible is the best practice. Again, if you're concerned though, and the child you don't think is doing well, I also wouldn't hesitate to call 911 or get them to the emergency department as soon as possible. But the vast majority of cases can be managed at home, and certainly in consultation with your pediatrician, your nurse helpline, telemedicine. Do I need to quarantine around family members? Depends if you like your family members or not. I'm just kidding. So RSV is highly contagious. And so it comes down to practicality, I think. If you're clearly symptomatic, if you have the opportunity to use a bedroom and stay there and try and avoid your family members, you're doing them a favor, and hopefully you'll prevent them from getting it. But again, if it's a cold, you can treat it like any other cold that you've done in past years and past seasons. It tends to run in families. My kids have all had COVID. We kind of locked them in their room, so to speak, but they're only so compliant. Somehow I managed to avoid it. My wife managed to avoid it. Again, a lot of it comes down to hand washing, making, if they're old enough, them wear masks, et cetera, et cetera. You don't quite honestly need to lock yourself in a room or go get a hotel room at this point in time. But again, everyone has different risk profiles and risk tolerances. I love the question about what about my pets? Can they get the virus? I actually didn't know for RSV, and I checked, and everything I could find is RSV cannot be is not caught by animals, and they can't give it back. But I will say that other viruses absolutely can be transmitted from other respiratory viruses from animals. It's unusual, it's rare. They've done a lot of work on COVID-19, and you may have seen a tiger at a zoo was diagnosed with it. They've isolated it from deer and other things. So it's possible. Please don't get rid of Fido or Fluffy. They're not the major source. You're much more likely to get it from Ralph's or Albertsons when you're there. And in all likelihood, your pets are not going to catch it nor give it to you. Is there a vaccine? Great question. Maybe soon. There's 4 vaccines in various stages of development. Some of the results have been very positive, but as of this moment right now, there is no vaccine for RSV. And hopefully in the near future, potentially within a couple of years, we may see a vaccine for RSV. For those that have been Googling or whatever your search engine is, there was a vaccine for RSV several years ago. But in fact, when they looked at it and actually started distributing it, it caused actually some individuals to have more severe disease from RSV. That was pulled from the market. And so, again, it emphasizes the need for proper testing and trials. Why does RSV cause more severe infection in small kids and babies? I think we touched on this. Some of it is just their small size, their small airways, their immune systems are not fully developed. Sometimes they're obligate nasal breathers. A combination of all of that just causes more severe symptoms and severe disease very young. Fortunately, older children, adolescents, and adults that are otherwise healthy, again, it's at most a cold or even asymptomatic, rarely causing significant disease. And I think that is my last slide. So I'm happy to take any additional questions that individuals may have.
Wow, that was terrific. I learned so much, and I feel like all of my questions got answered. So I don't have any at the moment.
Okay.
That was really informative, and I loved the chart of RSV versus the flu versus the cold. That really was wow for me. That was great.
Good. I'm glad it's helpful.
Yes. Does anybody else have any questions?
I don't have any questions, but I just wanted to say thank you. I agree. The chart was very helpful. I have 3 kids, and trying to figure out what they have between the flu, RSV, and COVID is sometimes difficult. So I'm in the doctor's office every other week, it seems like. So thank you so much for providing that information.
Of course, no problem at all.
Dr. Stay, how do you feel about having a COVID and flu shot simultaneously? I know they're offering that.
So, sorry, I'm laughing because I had that exact conversation with myself a few weeks ago. So there there's you certainly can get the flu and COVID shot at the same time. They recommend it in different arms. Um, I didn't see any reason to put my body through that. I got mine 4 days apart. And again, I think it's personal choice. There's no medical reason why you can't get it at the same time. Um, I just, I personally, in full transparency, got them separated by 4 days, and 4 days was no magic number. It was just I went on a Monday and then Thursday to our employee health. It just worked out on my schedule.
So speaking of the flu shot and cold shot, is this the do we get it right now, or are we supposed to wait a little bit longer?
Ooh.
What is the recommended window?
Great question. So you're behind you're behind if you haven't got it yet, and it's never too late to get it. And so I'm calculating my answer because I'm kind of not weird, but anal about when I get my flu shot. So your flu shot, we absolutely, once you get an immunization, an annual shot, your immunity goes up, and then over the course of the season, it goes down. So I try and time my shot, and it's kind of playing chicken with the flu. You know, I follow the flu, and I can see when it starts on the east, and I have the advantage of seeing what's happening in our hospital and seeing if cases. And it takes, you know, a couple of weeks before your immunity from the flu shot kind of peaks. So if, as an example, if you happen to be exposed to someone with the flu and go, oh, I better go get my flu shot because then I can boost my immunity and that'll protect me, the flu shot's not going to protect you from that exposure. It takes a couple of weeks. This year I got offered a flu shot at Albertsons or Walgreens or something back in August. Personally, I think that's too early because my concern is come March, April, if you have a long flu season, your immunity is kind of waning off. So I'm going to say officially anytime in October, late September is fine, or September, October. Historically, I've always waited till the last 2 weeks in October, and that's just my personal preference and what I have done just to try and maximize my protection. And again, I'm in a different kind of risk category because I'm running around the hospital all day with flu patients and everything else. But I think anytime September, October is fine. If you haven't got it yet, I strongly encourage you to get it. This is, as I've shown you, going to be it's already a bad flu season and it's going to get worse. And so it's never too late, especially if you're going traveling and visiting other individuals. There is a lot of flu and there's going to be a ton of flu later this season as well. I see a question from
Hi, hello. Thank you so much for doing this. I have a question regarding the vaccine. So I have a 5-year-old. He just turned 5-year-old this 5 last weekend. He did get a COVID this summer, but luckily it was very, very light. So he had very little symptoms, but it was positive. So I was waiting for him to turn 5 to get the full shot, not to give him the half shot. And I also know, I was told that I need to wait, a certain number of months. So is that okay now, since he got in August? Can I get an appointment for him, like in the next couple of weeks?
So just clarifying, you're talking about the COVID shot.
Yes,
So in
correct.
fact,
He already had his flu shot like a month ago.
outstanding. And yeah, so there's actually no waiting period after you've had COVID. The recommendation is don't go while you're symptomatic and wait until you're asymptomatic. And that's more for protection for the person giving you the shot than the person themselves. Again, I'll give you the official advice and then the doctors say personal kind of view on this. So if he's had the COVID infection, his immunity from the infection itself goes up and then it wanes down over time. There's definitely benefit to getting the vaccination because the immunity just from an infection itself is probably not as good as from vaccination and not as good from having COVID and the vaccine itself. And so that immunity or that really strong immunity, especially with the variants that are running around right now, tends to wear off after now 30 days. It used to be more 90 days. So I was saying, you had COVID, you got 90 days to wait. Now I say, if you don't want to get it as soon as they're asymptomatic, wait 30 days and then get it. So you're absolutely fine going ahead and getting the
All right.
vaccination.
Thank you. Appreciate it.
Of course.
Great. Well, thank you so much for your time. I really appreciate it. And I'd like to invite everybody to our Long Beach Moms Business Networking mixer at Old Ranch Country Club, where we will have the technology about the virtual visits. We're going to be reviewing that. And so, per this discussion and presentation, I think it's really valid because we do get sick and we don't want to go to the doctor's office for many, many reasons. And so thank you for your time and for being here, and follow up with any questions via email with me. And Martha, Dr. Graham, thank you. I appreciate you.
Of course, my pleasure. Stay safe. Have a great holiday season.
Great.
Thank you.
Thank you.
Bye.
All right.
Thank you. Bye. Thank you, Angelica.
You're welcome.
Thank you.
You're welcome.